So good afternoon, everybody. As you know, my name then is Bernie Hannon. I work in the vascular unit in James's Hospital. Now, I primarily work with patients with underlying venous disease, which includes varicose veins, venous leg ulcers, lymphatic disease, and post-thrombotic syndrome. So today I'm just going to talk to you a little bit about what post-thrombotic syndrome is and about the different types of compression stockings and garments that are available. So what is post-thrombotic syndrome? So post-thrombotic syndrome is a condition that develops post a blood clot in your leg, a deep vein thrombosis, and it results in pain, swelling, and discoloration of the lower limb. Post-thrombotic syndrome is a chronic disorder. It's not curable, but it is manageable. So it develops after DVT in about 25 to 50% of patients. Unfortunately, the more DVTs you have, the higher the risk of developing post-thrombotic syndrome. And other contributing risk factors include high BMI and the older patient. So as you can see from this picture, this is the vein anatomy, and veins are made up of deep veins and superficial veins, just to simplify it all. And veins function by bringing blood back to the heart. Arteries bring blood all around the body, and veins bring it back to the heart. So as I said, we have femoral veins, which are deep veins, and then we have our saphenous veins, perforator veins. Reticular veins are the more superficial surface veins. So femoral vein is one of the deep veins, and more likely, if you're going to have a blood clot, you'll have it in a deep vein. As I said, the veins carry blood back to the heart, and they carry blood back through a channel called a vein that is interrupted with a valve. So the valve works by opening, the blood passes through in one direction towards the heart, and the valve closes tightly to prevent backflow. So the blood is moving in one direction. If you have any damage to that valve, it can cause chaos in that valve. It can cause the blood moving in two different directions instead of one direction, because that vein valve, that gate that opens and closes, is not closing properly, and you get this leakage or backflow of blood, which causes increased venous pressure. So what happens in the vein when DVT occurs? We're not quite sure, because the blood clot can happen in different parts of the vein. It may damage one of those valves I was just talking about, or it may obstruct the blood flow in the veins. And this will cause that blood flow going backwards and increasing that venous pressure in the lower limb. This venous pressure that I have talked about is the key to the symptoms of post-thrombotic syndrome. So increased lower leg venous pressure will lead to leg swelling, skin changes, and in severe cases, leg ulceration. And when I'm talking about skin changes, I'm talking about a brown, purpley discoloration of your skin that gets darker over time. It starts off as a mild tan look on your skin, like a skin stain, and then it just gets darker and darker over the years. Eventually, this dark skin may become quite dry and a leathery appearance. It may crack, and a small little break will happen, which will develop into a small wound. A wound on a lower limb that does not heal in 2 weeks is known as a leg ulcer. So that would be the end result of post-thrombotic syndrome, is developing leg ulceration. And this here is two pictures just to show you the damage that increased venous pressure from post-thrombotic syndrome can cause. So as you see the picture on the left, your right leg in that picture is the leg that had the DVT, the blood clot in the lower limb. And you can see that skin discoloration I was talking about, that reddy, purpley, brown around the edges, that pretty much starts from the middle of the foot up to mid-calf, mid to upper calf. You can see there's swelling there, but the skin is still intact. Whereas in the other picture on the right, this leg is many, many years after a blood clot, and the skin, as you can see, is quite thick, brown, leathery skin. And on that medial lower calf, you've got a wound there now, and that is a leg ulcer. When do symptoms of post-thrombotic syndrome start after you have a DVT? And that's also a gray area and hard to define, because initially when you get a blood clot, you have swelling, you have some redness around that lower limb, and you have discomfort. So once the DVT is diagnosed and you start on your anticoagulation and you're wearing your support sock, your class 2 compression sock, those symptoms relieve. But further on down the road, 3 to 6 months or even up to 2 years after that initial onset of DVT, you may subtly start having lower limb swelling and you may notice some skin changes on your leg. Oftentimes, the patients that are referred into us for evaluation of query post-thrombotic syndrome will tell us these symptoms didn't start for maybe 5, 10, 15, 20 years after that DVT. So it's actually quite difficult to know. There's no definite time span on when these symptoms start. And as I said, they'll start off mild and then develop into intractable leg swelling, irreversible skin changes, and unfortunately, many years down the road, you may end up with that leg ulceration that I described already. So as I said, the incidence of post-thrombotic syndrome is around 25 to 50%. So six out of 10 may have no symptoms after a blood clot. 3 out of 10 will have that mild leg swelling, a little bit of skin staining, so some degree of post-thrombotic syndrome. And then 1 out of 10 will develop that severe skin changes and plus or minus leg ulceration. How do you prevent post-thrombotic syndrome? Well, of course, the obvious one is prevention of DVT in the first place, not getting a blood clot in your leg in the first place. Secondly, wearing compression socks post-DVT for at least 2 years is what we would recommend. So initially, when you have a blood clot, you may be placed in a full-length compression sock, depending on where that clot is in your leg. So that compression sock, along with your anticoagulation and your painkillers, will relieve those symptoms and manage that DVT. After probably the first 6 weeks, you could replace that thigh-length sock with a below-knee sock and wear that during the day, off at night, for up to 2 years post the diagnosis of the blood clot. And that's the best advice we have out there at the moment to try and prevent post-thrombotic syndrome. There is a lot of evidence out there, a lot of research, some conflicting, about the prevention of post-thrombotic syndrome. Some evidence will say that socks will help prevent it. Some will say wearing of socks will not, but definitely our advice is to wear the socks, because there's one thing for sure: wearing socks will not cause post-thrombotic syndrome. So diagnosis of post-thrombotic syndrome, as I said to you earlier, we do get quite a lot of referrals in from GPs with patients that have these signs and symptoms of post-thrombotic syndrome, but just don't have a diagnosis. So clearly on examination and on past medical history, you can pretty much diagnose post-thrombotic syndrome quite easily. There are various scales that some professionals use, and these scales would score the different symptoms, and depending on the score they get, it'll fall into a probable, maybe, definite. That's one of the scales that is used now and again in our practice, is the Volata scale. But to be honest with you, clinical examination, signs and symptoms, and past medical history is usually enough. How do we treat it? So we're back to our compression socks again. So if the skin is intact and there's no sign of any ulceration, we will fit the patient with compression socks knee high. We will advise on skin care, very important, daily skin care, washing, drying well, and moisturizing. And the moisturizer we use and recommend here is Aveeno. Exercise, very important. Walking is as good as any exercise, but if you like the water and you like swimming, water is very good to relieve symptoms of lower limb swelling. Weight management goes without saying. Elevation of the lower limb when sitting. And then if there's a leg ulcer in place, of course, we will place the patient in compression bandaging initially to heal that ulcer. And then when the ulcer is healed, you should go into knee-high compression socks for life. And as I say again, wear the socks during the day and they're off at night. So how does compression work? It improves venous return. So as we said earlier in those slides, the vein carries blood back to the heart, and it has a network of valves throughout the length of the vein that open and let the blood go through and close tightly. If they are damaged, the valve doesn't work that well and the flow is a little bit chaotic. But once you put a compression bandage or sock on that leg, it will move the blood and help the blood move in one direction back to the heart. So that will decrease any pressure in that lower limb and relieve symptoms such as swelling and tightness and heaviness in your leg. It will also, compression, improve skin integrity, restore the limb shape, and as I said earlier, bandaging, as in compression bandaging, are used to heal ulcers, and then when they are healed, we use the compression stocking then to reduce incidence or recurrence of those leg ulcers. So correct compression hosiery and garments, they must be prescribed by a healthcare professional. The limb must be measured to make sure you have the right size sock on or garment. Instruction on how to apply correctly. Like a knee-high sock is actually a below-knee sock, so it doesn't need to come up right onto the knee. It needs to sit just below the knee, 2 fingers below that space behind your knee. Otherwise, it won't be comfortable. It'll dig into you and you'll probably give up wearing them. So they need to be fitted properly, sized properly, and comfortable to wear. Some limbs are not suitable for socks that you can buy off the shelf in the pharmacy because they may be too thin or they may be too big. And these limbs may need custom-made socks. Compression garments need to be replaced every 6 months. That is really important because the elasticity wears on them. And if you continue wearing them, even though they're intact and there's no holes in them, they're not doing the job they have to do. I just want to mention here the cost of compression garments. If you have a medical card, they are covered fully. If you don't have a medical card, buying a pair of compression socks off the shelf will vary 50 to 60 euro a pair. If you need to get custom-made socks, they work out at about 250 a pair. Or if you need a compression wrap, which I'll show you in a second, they're about 100 to 150 each. As I said earlier, all these wraps, custom-made socks, below-knee socks, thigh-length socks are all covered on the medical card. And these are the famous socks. So knee-high socks with toes out or toes in, thigh-length socks, and they also come in different colors. You can get them in tights. You can get the leg that needs to be compressed with compression material and the other leg in normal material. And the bodice of the tights will not have any compression, so they will be comfortable. They work out, compression tights are up on 70 to 100 euro for one pair of tights. They do come in different colors, as you can see, as do a lot of the socks as well. Compression wraps are new on the market, maybe 4 or 5 years. They are an alternative to compression socks because they can be wrapped around your leg and secured with Velcro. And why they are an alternative to socks is some people find pulling a compression sock on their lower limb quite difficult. Maybe they have a little bit of arthritis in their hands. They may have low back pain. They may have poor upper body strength. So the wrap sometimes is a good alternative. The wrap comes with a liner, as you can see, that cream-colored liner next to the skin. So most wrap companies will supply 2 or 3 of them, and then the wrap material goes over that. So really, you just need to wash the liner every other day. The wrap material itself doesn't need to be laundered as much. And these are the companies, Medi, Healthcare 21, and Uniphar are the 3 companies at the moment that I'm aware of that supply wraps. Made-to-measure socks, as I mentioned earlier. These are the companies Ceranova, Jobskin, and Healthcare 21. They measure patients for custom-made socks. And as you can see in the picture, a custom-made sock can come with a zipper on the outside or the inside, or no zippers at all. But when you are measured for custom-made socks, these socks are fitted for your limb and your limb alone. They take about 50 measurements, so it has to be somebody trained to do that. A pharmacist will not be able to measure for custom-made socks, or anyone else in a pharmacy. It has to be a representative from the company, because these socks are very, very expensive and you don't want them made and not fit you. So they have to be done correctly. Lastly, then, I just wanted to say a little bit about sock donning aids, because I know people can find socks hard to put on. So Medi supply, they make compression socks, and they also make this Medi Butler. So that's the top picture there. And it's a device as well. You put the sock over the metal frame and put your foot in and pull it up. And it works quite well. And a few of our patients have bought these. And one gentleman was in last week and he demonstrated it to us. And it worked quite well, actually. The second one down, the green and black one, is Steve. It's invented by a chap called Steve, obviously. In the UK, it's supplied by Fanon here in Ireland, or also you can buy it on Amazon. It's quite good. I've seen it in action. When it's all put together, it works quite well. I find it a little bit fiddly, to be honest with you. The last one then is Easy As. It's actually a donning aid that originally came from Australia. It can be sourced now through a UK company. It's quite good. I actually like this one. The Medi is quite good, and this Easy As is quite good as well. And we've had all of our patients, not all of our patients, but some of our patients that have come through our clinics have bought these products, and they give us feedback, and these would be the three most popular. They range in price from anywhere from, I'd say, 30 to 70 or 80 euros each. But I'm sure they are worth it. And lastly, then, just the doffing aid. Doffing is to remove the sock. It's also available through Medi and can be bought in a pharmacy. And basically looks like to me like a large shoehorn. It works quite well. A couple of our patients have bought it. It's just something else to think of if you're trying to get these socks on and off, because at the end of the day, we want you to wear the socks. So whatever makes it easier to get them on and off and have them comfortable on you. So that's about it. I'm happy to answer any questions, and thank you for listening.
Thank you, Bernie. That was, my God, absolutely fantastic presentation. And I'm sure everybody listening has learned so much about post-traumatic syndrome, which we get a lot of calls about. So there's a question here. I had an extensive upper limb DVT in May. A venogram shows loss of valves. My symptoms are tired, fatigued arm, and I need to move position of my arm if I'm sitting. Not a huge amount of swelling. Any advice?
Hi, can you hear me?
Yes, perfect.
All right, that's fine. Let me just see. I'll just put this video on because I just feel, no, I can't do that. Okay, that's fine. I'm not that familiar with upper limb, to be honest with you, because we don't have anybody come through our clinics with upper limb. Isn't that what you said, an upper limb?
Yes.
Okay. So I would gather that you would be wearing a compression sleeve then. Is that what the question was? Are they wearing a sleeve as it is?
Yes.
So they are wearing a sleeve. So I would presume, I can't really give you definite advice. I presume you would wear the sleeve for life.
It doesn't say that they're wearing a sleeve.
Oh, it doesn't say they're wearing a sleeve. Yeah. So I'm not familiar with upper limbs at all, but I just from my own experience, past experience, I have seen people that have upper limb problems wearing sleeves that are similar compression. They're class 2 sleeves that are similar compression to our lower limb socks. So I would presume, but to be honest with you, I won't stand over that advice because I'm not familiar with upper limb at all. I'm sorry.
Would the same companies do the arm sleeve as they would do the leg?
Absolutely. So the companies like Medi, like Healthcare 21 and Serenova, and Job Skin, they would be four companies now I've mentioned on my slides, but they would all do upper limb sleeves pretty much in the strength that I've talked about for the lower limb garments. So that class 2 compression.
Okay, and Maria, maybe you'd make contact with us and we'll see if we can get further advice on that, but you probably recommended to get measured for an arm sleeve with one of these companies.
Absolutely, yeah, it would be very specific. You see, I suppose the thing is, for custom-made garments, you need to get the limb the smallest it's going to be. And oftentimes with our lower limbs, we often bandage initially to get the limb as small as it will be, because oftentimes there is swelling in that lower limb that can be reversible with bandaging. And when that's done, then they would measure that limb as its smallest size and then make that garment, because there's no point in making a garment that's going to reduce the swelling initially and then it's too loose. So I'm not sure with upper limbs, but I know if you talk to anybody from those companies that make those custom-made garments, they would have better advice, Anne-Marie, on how to reduce that initially. Sometimes wraps are a better option.
Are they an online company, or if you go to Fannon's, would they stock Medi products?
So if it's a custom-made garment, you'll have to deal with the company directly, because these custom-made garments that are made for your limb and your limb only are only available through the companies. They wouldn't have them on shelves in Fannon's or anywhere like that. So if it's not a custom-made garment, if it's a standard size, would range from 1 to 7 or extra small to extra large, I'd still go through the companies. And probably one of the Medi would be the company that the supplier is Irish-based, Les Hughes, but he has an online site now, so medi.ie. If you went to Medi, and they would have a contact number there and they would talk to you about it. But I'm just not 100% sure on upper limb garments, so I don't really want to say much about them because I don't know.
No problem. That's no problem.
Okay, but I'm sure, I know those companies do them, but I've never actually had one in my hand because all our patients are lower limb disease. Is that okay?
That's fine, Bernie. Thank you very much. We'll look into it more and see if there's any more, but I'd say it's similar to the lower limb. Absolutely, anyway, yes. But we'll check into it further and get back to the patient. Thank you very much for your presentation, Bernadette. It'll be an absolutely amazing asset to have on our website, and we really appreciate the work that you've put into it and given up your time. Thank you so much.
Okay, all right. Thank
you. Bye.